It is 1:04. I'd like to call to order the Wednesday, June 18th, 2025 Health and Human Service Committee meeting. We have a pretty packed agenda today, so I'm going to keep things moving as quickly as possible. I don't have any changes to the agenda. We do have one blue card for public comment, and that is Mullen Quay. Is that how you pronounce it? Can we come back, please? All right. Well, we're going to move on and come back. Can I get somebody to, the minutes approval for the last meeting, can I get somebody to? All right, we have Amanda and Shauna seconds. We have two appointments. Everybody's got to vote. For all those in favor of moving the minutes, please raise your hand. Thank you, Randy. For appointments, we do have a few. Community Mental Health Service Board, Thomas Kelly, at-large member, term expires December 31st, 2025. Community Mental Health Service Board, Substance Use Subcommittee, Howard Reed, Community Mental Health Service Board Representative, term expires December 31st, 2026. Julie Carmont, Community Member, term expires December 31st, 2025. And for the Human Rights Commission, Adam Shoney, Commissioner, term expires December 31st, 2027. Do I have a mover? Do I have a second? Randy? All those in favor? All right. I do not have a chair's report because we do have a long agenda and we have a lot of stuff to get to. I guess we'll go into the county administrator's report, and when Mullen gets here, we'll circle back.
Thank you. I will share my screen. So first item I just want to report on is the hiring process for whole health and social services commissioner process. I think we completed the whole health process yesterday. I'm really excited about that. We are at the tail end of the social services commissioner hiring process. We anticipate concluding that hopefully by the end of this week, and then I will send an email out as an update to you. And my hope is that the legislature will be able to appoint somebody into the role at the next sitting, which will be July 15th. So the biggest item I have on my table is the Office of Human Rights, and I just want to share my screen first and foremost. Where are you? Okay. Voila. Okay. So when I came on 5 months ago, still very, very new, one of the roles or responsibilities that I was bestowed on me was to examine the Office of the Human Rights and come up with a process to make it effective, or other alternative arrangement around the office. In my role over the past years, I have had a very minimal engagement with the Office of Human Rights. My previous role in a different county, we didn't have an Office of Human Rights. So it was a completely new encounter for me. So the majority of the work I did was in relationship with the Human Rights Commission. So as part of the discussion of these slides, I will invite Pei to join me in going through some aspects of this presentation. I will say the majority of the tasks in here were was a result of her research into the department and her work with the office over the last multiple number of years, and also multiple number of engagement with some community members. I had a lot of help with the Office of County Administration to understand the role of the Human Rights Office and its relationship with the community and the expectation of the office in itself. So, yeah, you're welcome to sit right here.
Take a chair.
Yeah. Okay, so before I go into the slides, if you have anything you want to open up with, and you're welcome to do that.
Thank you so much. I've wanted to come throughout the past few months, but I'm usually teaching at the time the meeting is holding. It's really been an honor to work with COSA and with with commissioners. It's been exhausting. It's been very overwhelming seeing the enormity of the needs at the office. We began in January trying to first ascertain where things were, reorganizing the office in a way to make it more welcoming, make it proactive, creating outreach to the community, inviting them to come, and buying snacks, drinks, food that could make people feel welcome. We began going over the files and discovered that there were issues in terms of how there was documentation. Often people's follow-up information was sometimes missing, so we began recreating a structure around that. It's been wonderful to have the chance to firsthand work with the level of pain and need and marginalization, isolation, demands in the office. Looking over what we've done, I'll just quickly mention a couple of the data. It's not fully complete, but we've had to deal with issues regarding employment, workplace issues, unfair dismissals, between 20 to 30 inquiries, housing-related issues, over 30, public accommodation, well over 20, issues about bullying in schools, racial harassment in schools, particular districts emerging over and over and over again, with parents getting to the point of wanting to withdraw their kids from school because of, harassment. We see videos, we see photographs, we see requests for help in terms of people being afraid of talking with or communicating with officials. Public safety matters, we've had several of them, but I suspect that some of the work CJC has been doing has actually helped to reduce that pressure. Issues that had to do with outreach, race, color, harassment, going on to 30, disabilities, workplace. We've spoken with at least 19. And don't forget that each of these cases often requires repeated phone calls, communication, scheduled visits, people coming to the office to sit down with us, needing assistance with writing letters, needing assistance just to how to mediate, what do I say to people who are, in positions of power and authority over them. Issues around gender, identity and expression, numerous. The absence of adequate mediating organizations, they're working hard, but people have come to see it as a need. Sexual harassment, we've dealt with about a few of them, maybe about 6, 7 complaints of sexual harassment. There are people who have called with repeated, there's someone who, sometimes we start crying literally when you're working with people. A person called, she left about 7 messages over the weekend before we could even start our office hours on Tuesday. She's a homeowner, someone is trying to destroy her. I'm being harassed, threatened verbally and physically, had a gun pointed at my face, I'm suffering, and you're hearing them cry over the phone. So because of that, we've had to really set aside much of our own work to be able to begin to attend to these issues in the office. We've had to I trained interns. We've had about 10 interns helping. I would set them in one of the offices and say, do some research on this issue. I want information on DASA. Who is the communications person at this school? Who should they reach out to? We then compose an entire, texts, written, people want, don't email me, text me. I'm anonymous. We've had calls about immigration. We've had calls from people in high-ranking positions in the community who want it kept secret and need us to help them walk through what should they do. It has been good to be stretched in that way. Part of what HRC does to support the office is that the office, as Kosa will explain, in many ways has this dedicated ability to work at an individual level. And while HRC should be taking that macro, preventive, proactive measure of working with populations, groups, agencies, and so on. And so juggling that has really brought us to the idea that, there is a growing and a very desperate need in the community. And also the need for a physical space. Last week, I was working with a couple that came into the office, a mixed racial relationship. They had faced discrimination at a store because of a situation of stalking by an ex. The store didn't understand and so ended up banning them because the ex was stalking them, following them about, and it was hard for them to communicate this. And the police were called in on them. They felt so aggrieved, they broke down in the office. There were about 5 people waiting for attention. We have Spanish-speaking people who come into the office. They eat, relax, take water, take food, whatever, drinks and snacks. And as I worked with them for 2 hours, I said, okay, these are your steps. From here, you need to go to the police station, you need to get the incident report, you need to get this, and I gave them the options. As they went to the police station, they were again accosted by the person stalking them. Within 15 minutes, we saw them running back to the office. They ran back to the office. We had to shelter them in place for 2 hours. I had to go out and de-escalate the situation with the ex while we were waiting for the police to come. As they were leaving, the woman was hugging me and crying and saying, thank you, because being there as an office space gave them a sense of dignity, of protection in talking to the police, of feeling protected. And there are still several situations that we have ongoing. So I believe that while there's evidence that the office has done incredible work in the past, there's also evidence that we have failed in many areas, and that, I think, is where the concern is, rightly so. The question should be, how do we improve it? How do we make it a sanctuary, a place where it can fulfill its goals? And I think we have some thoughts about how that can really be accomplished.
Thank you. So I will quickly run through the slides here, but one of the things that I just want to set the scene is, I think earlier on when I was given this task, I was told to come up with some options, what to do with it. I would say, unfortunately, I don't have options. I have an option, and the option is to sustain what we have and to improve it, to enhance it, to make sure it responds to the needs within the community. So I titled it a strategic vision for Tompkins County, revitalizing the Office of Human Rights. So the executive summary basically talks about the commitment between the county administrator's office and also the Human Rights Commission chair in developing a collaborative leadership. We have had multiple meetings and missed calls over time to trying to work out through what is happening there, how can we interact, how can we improve engagement. And based on what Pei has related is the fact that they are sacrificing their own work because the office doesn't exist, for them to be there, for that presence to be available, for people to actually come to and meet people and talk to them. So that lack of presence of the office is creating that vacuum, and it's making it's bringing in more work on the commissioners directly related to the people's needs and expectations. So we talked about integrate parallel functions as the Office of Human Rights and also the Human Rights Commission, and also, as she mentioned, the work of the Community Justice Center. There's a great amount of work being done in the county, and from what we can see, there's some degree of silence within how each of these organizations work. So what we're trying to do is, how can we integrate as much as possible those functions, those responsibilities, so that all of us are serving the same groups, the same community members, and same population. So we also discussed renew community trust and effectiveness and increase responsiveness to be able to respond quickly as possible to the needs and expectation of the people. This slide talks about the historical context and the current challenges that the office is facing. So it's founded with the important mission of protecting civil rights and preventing discrimination in the county. Also present an opportunity to rebuild and strengthen public trust through renewed engagement. We talked about the current challenges, if addressed, could clarify the role of the Office of Human Rights and then the commission itself. With modernized systems, increased support response capabilities can be significantly improved, and also community feedback indicate that there is an opportunity to better serve vulnerable population and ensure more inclusive outreach. We also discuss, or we identify staffing limitations as well. Currently, we only have one staff in the office who's an administrative support. Even when we had a director in the role, there was a limitation in terms of outreach, in terms of public engagement, and we believe that enhancing that element of the work will improve outcomes within the Office of Human Rights.
Can I just say a quick word? Part of the reason for that diagram was to show that human rights is not in opposition or an alternative to those other organizations, but it forms what we call a framework. It's called a right-based framework. So whether it's housing or police relationships or social services, they emerge out of that essential framing, and that's what an Office of Human Rights provides in supporting these other organizations.
Okay. So we also discussed the core mandate and endurance strength of the Office of Human Rights. So basically the original mission and existing asset is investigate discrimination claims and advocate for policy changes, establish legal authority and dedicated commission members, and also history of successful intervention in housing discrimination and education. It also provides a unique position to coordinate equity efforts across the county departments. And then we have the chief equity officer in the county, but we also believe that through better integration with the chief equity officer and the Office of Human Rights can also really address those inequality within the community as well as in the county administration itself. There are people who may not be comfortable talking to maybe county administration, their department head, or even the chief equity officer. We believe that the Office of Human Rights, if it is active and effective, staff can actually go to them and also relay to them challenges they are facing within their offices, and that can help us address them and be aware of those problems and be able to confront them as quickly as possible.
Can I quickly say something about the difference? I think there's a lot of confusion for people about the difference between human rights and the Office of CEDAW. And the focus on discrimination, elimination of discrimination, is in only 2 articles of 30 articles in the Universal Declaration of Human Rights. So it focuses on the idea that those 2 articles speak specifically against eliminating discrimination, and that's what the Office of CEDAW is dedicated to do. However, you have 20-something other articles and at least 9 major covenants that have to do with positive rights, rights to this, to water, to safe living. That's not the work of CEDAW, but that's the work of an Office of Human Rights to advance what we call positive rights that are committed to by a state. And that's what I think is essential to understand a huge difference between those offices.
I think we also looked at some of the successful initiatives that the office has championed over the past multiple number of years. We talked about, we identified from their records that they conducted some successful housing discrimination investigations that contributed to meaningful policy improvement within the community. They also deliver impactful educational workshops on implicit bias, enhancing awareness among county employees. So before what we identified is that before we had a chief equity officer in place, the Office of Human Rights was very instrumental in our policy improvements in terms of addressing some of those challenges that existed. We also identified that there had been a relationship between the Office of Human Rights and some local schools to implement proactive anti-bullying initiatives, and also we identified that they facilitated constructive communication, community dialogue to advance understanding and reform around policing practices. So before also the Community Justice Center came in, we saw that the Office of Human Rights was active in some of those police and community relationships. Yes.
Do you want questions during or after?
No, you can ask questions. Sure.
On this slide, in the last slide, the word investigates is used. And before my time on the legislature, I remember being part of the community and all the conversation that happened maybe 8, 9 years ago now, where the former human rights director pretty much put us in a situation with New York State where we couldn't investigate anymore. So I've seen it pop up twice. So I guess my question is, if we are no longer in a position to investigate, are we investigating? Because that's problematic. Or has something changed and we do have the ability to investigate, but we're just not all aware of it?
I think that's a fantastic question. And it might have been the missing piece that really affected the working of the office over time. So I want to go back. I tend to be someone who's a little very specific on details of the mission. And you are so right, Travis, that that ability to investigate was removed. But something was left there in the mission of the office that is in accordance with the New York State Division of Human Rights. In the specific goals and roles of the Office of Human Rights, C says it has the ability to inquire into incidents of tension and conflict among or between various diverse groups and make recommendations or take such action as may be designed to alleviate such tensions and conflicts. So that's first one, which has to do with groups. And that's very powerful because it does give you the capacity to inquire. What New York State was saying was that the power to make authoritative, binding legal decisions in terms of investigation is what has been removed. But the ability to look into matters is not been removed. E, it also has not just to advise people on how to file complaints, not just to provide facilities and equipment to assist people in filing complaints, but in matters and complaints within the jurisdiction of the office. But outside the jurisdiction of federal and state agencies, investigate as may be needed and prepare its own plans with a view to reducing and eliminating such alleged discrimination through the processes of conference, conciliation, and persuasion. So it's very expansive. And it's incredible because a lot of people, that's what they want. Do I need to go on with a legal case? Do I need to file a complaint? What can you do at this level? That's what New York State allows them to do. But the misinterpretation of that has led to a kind of complete withdrawal and then limited the office to these educational outreach. In reality, a lot of people who come there, after we listen to them, offer this, say, okay, you can do conciliation, you can do persuasion, you can do conference, which means you can call the parties together and confer with them, help them to understand the issues, perhaps make a decision not to have to file a legal complaint. That's what they can do. So I think you're right that that legal investigation side is not necessarily there, or to adjudicate in terms of legal decisions binding. They can reject your decisions, but the office does have the power to inquire and to investigate if it's not under their jurisdiction.
Thank you. Any other question on that?
We've had a contract with the CDRC, and we do contribute to them on an annual basis. Are we using their services?
Not as much as possible. Okay. A few people who have, I guess, partly because maybe they went through a period where they didn't have as much, staffing and so on. And then the emergence of other centers that are also doing this. So I think one of the things we were proposing is to ensure that even the new staff at the center can get maybe co-training in being ombudsperson training. I recently received, which is one of the reasons the office needs to be open, this entire bundle from New York State, which is the Regional Council Members Code of Conduct. And one of it is facilitating meetings around community conflict. So this entire thing, we're supposed to be at a meeting coming up where they're really training us on how to facilitate and deal with community conflict. So working with them, I think, would be wonderful to increase that and to improve that. And I think it'll be good to have a couple of members of HRC also be trained in that, along with members of the office, and then to work more closely with them.
Thank you.
I think it's a fantastic, approach for improving.
Thanks. One little thing, I happened to have a meeting with a very dedicated volunteer from the CDRC, the Community Dispute Resolution Center, folks don't know, like 2 days ago, and who said that they have, in the recent year or so, been really focusing on outreach and trying to expand people's awareness of their services. So I don't know what their capacity was like in the past, but now seems like a good time to follow Shauna's suggestion.
That is fantastic, because it's so desperately needed. A lot of people actually do not want to go to them. They know the consequences. We've had several workers who said, I'm scared of, retaliation. I would like to have it settled. What can you do? And we would love to, kind of make sure that we reach out and work with them in partnership.
Thank you. So just to quickly go on, we talked about reimagining the Office of Human Rights and Human Rights Commission structure. One of the things that I identified through my engagement with the Commission is some degree of independency from the Office of Human Rights. So through our engagement, we felt that the Office of Human Rights actually provided some administrative arm to the Commission would be very helpful. Most of the time, you have Commission members using their personal emails and engagement through direct communication with people who are facing discrimination or who are reaching out to them individually. But we believe that if their office is effective and efficient, they can help with that coordination, they can provide administrative support processes, and they can become more of the backbone of the Human Rights Commission to make the Commission even more effective as well. So we talked about that integration, not just in spirit, but in actual relationship between the Office of Human Rights and the Commission itself.
Before you go on, can I guess I'm not really on board with what I'm reading here. I mean, the Human Rights Commission, the commissioners are volunteers, right?
Yes.
They're not paid staff. So I guess I feel like the folks that are paid staff are the ones who need to be sort of driving the bus, so to speak. And the commission is there to support the office and the staff and whatever the office is deciding to do. I realize this is different than other departments and other advisory boards, but that's essentially how all of our other advisory boards work, is that they don't, I mean, they can do independent programs, they can, set up, outreach program, they can write op-eds, all of that kind of stuff, but they're not the ones who are setting policy. And I guess I would have issue with that too. I mean, the legislature sets policy,
Yes,
not the Human Rights Commission.
Absolutely, and I understand the point you're making, and I think, like I said, if the office exists today, they will be here having this conversation and leading the top process that we are talking about today. So it is the office role that will be able to direct and manage and get stuff moving. The commission will provide more of a technical advisory role into what the office does. So just in a similar capacity like the Board of Health, who provide policy input into what the health policy that the county legislature will adopt. So we will leverage the expertise of the commission in terms of certain specific set of policies. So they will not be doing the administrative work. The office will be doing the administrative work by relying on the direct input and engagement from the commission in terms of their role and in terms of their work as well. But yes, they will contribute to the policy-making process, but it is the legislature who will set a specific set of policies, yes.
Sure. And then I guess maybe I'm not fully understanding, and I really appreciate everything that the commission is doing, and Peggy, I think, you know, you're absolutely right. There's so much work to be done. I guess I'm just also a little concerned that commissioners are doing this work of volunteering and like talking with people and putting yourself on the line. I mean, if you were to get hurt or attacked or, you know, I guess I'm not clear on why volunteers are doing this work and not staff who would be covered by all of our insurance policies and, you know, it's just a little bit confusing.
Maybe I can explain, and I do apologize because it's kind of a 30-page proposal that we will send around for you to enjoy at your leisure. But part of it is a very detailed history and the difference between the Human Rights Commission and other advisory boards that you have. I think one of the biggest mistakes the county has made, in my humble opinion, is a tendency to use the word advisory board and therefore categorize the commission in that sense. The Human Rights Commission emerges from the general municipal law. It's set up by the county under an ordinance by New York State, which follows both international and national understanding of what the work of a Human Rights Commission is meant to be. And because of the very nature of human rights, it's understood that human rights is often not necessarily supportive of bureaucracy or the government or politicians, as we know too well today. So New York State had to steer, like every Human Rights Commission, a very delicate line in trying to maintain the possible autonomy, independence of those who might have to speak out against policies that might threaten democracy, might threaten human freedom, association, and so on. And so the idea that because people are paid, they are therefore more supportive of human rights is sadly not really the truth. Thankfully, we've had wonderful people who are paid working in the office, but it's very easy for you to lose that sense of autonomy and fighting for it. So this is what the duties say in the charter. It shall be the duty of the commission, one, to foster mutual respect and understanding amongst all ages, and so on and so forth, protected classes. Secondly, to make such studies in any field of human relationship in the community as in the judgment of the commission will aid in effectuating its general purposes and where desirable, make the results of such studies public. So it does have to embark on this very technical work. That is not merely just volunteer work, it's literally almost like full-time work. Yeah. So when you join the commission, you either don't join it or you join it knowing its role. Next, it says, inquire into incidents of tension and conflict and take such actions as may be designed to alleviate such tensions and conflict. You can't just sit and meet once a month and say, hey, we're an advisory group. You don't join if you're not ready to do the work of the commission. To conduct and recommend educational programs, as in the judgment of the commission, will increase goodwill and open new opportunities in all phases of community life for all inhabitants. In addition to all other powers, the commission, to the extent authorized by law, shall have the power to report complaints to the Division of Human Rights, receive, accept, and use public grants and private goods, and so on. So it's kind of in this gray zone, you understand what I'm saying, where it's not an agency or a department of the county per se. And there's a challenge for every county municipality to say, what do we do with these commissions? Because they have a role that has to fulfill an international understanding of a commission. So it is challenging, I understand what you're saying, but at the same time, it's essential to the nature of human rights to ensure that they do have the protection of a degree of autonomy while also having the support and the protection of the authorities. So with what I'm saying is that essentially, it's not that the commission is, the individual work people can report to a commission, we would refer it to the office for one-on-one, but we still have the responsibility to do programming and this thing. So
Yeah, absolutely, and I appreciate all of that, and I'm not questioning the role or that it exists or anything like that. I'm just, if you're a volunteer, and I appreciate you saying if people are not going to do all of these things, they should not be joining this particular commission. But and we don't have to answer this right now, but there's still the question of, legality. If you're in the course of doing some of this work and you're hurt by, a person in the public, and, is the county going to be sued, or is that your personal expense because you have to go to the hospital, or, it is a gray area, and all the legalities of it are, I certainly don't understand it all, but I would like to know more before, figuring this out.
I mean, I don't know how to answer that. Maybe the county attorney will help us, but I do know that the commission was set up in the 60s and has been around. It's only very recent that the Office of Human Rights actually was relative to the establishment of the commission. So I think kind of similar to much other work that's been done by, other agencies. I think thankfully for now, I don't think it's been an issue, but it'll be good to find out that. I think the only choice would be for the county to either decide to completely dismantle the commission. It doesn't really have the option of making them county employees. That would destroy the reason New York State sets them up. And if the commission is going to exist, it's going to have to find a way to, come to terms with the commitment that it's making.
I think part of what we see happening, I got you, Shona. I think part of what we see happening is y'all's role has expanded to an extent because of the status of the office itself.
That's right.
And so you all are doing work outside of what you would normally do, especially in the height of what's going on, right? So a year ago, and this may have been a different conversation, it may have been less, but there's so much happening. Y'all are doing so much more than usual. So I think that feeds into, and in the story you just talked about with the couple, I think that feeds into what Amanda's saying, is while you're doing this work that's outside of what you would typically do, what then happens, and how are you all protected in the ways you need to be protected?
I totally understand you now.
Shona?
Thank you, Amanda. I agree with you. In fact, we plan to wind down our office hours. We were hoping to maintain it until we could persuade the legislature to staff the office and, emphasize that. So I do apologize. I understand what you're saying now. This is not something that we intend to continue. We're hoping to wind it down this month and to be able to continue full-time the work we normally do as the commission. And hopefully we would have county employees who will then be doing this work.
I actually am shocked to hear all the work you all have been doing. And I think it's a testimony to the fact that we've been receiving more cases than ever because our community trusts the people that are in that office. And so kudos to you and the other commissioners. I think that speaks volumes to how our community perceives your commission. With that said, and I do think what's in your presentation is very helpful, and it provides us with a vision of what the office could look like. I guess my question / concern is, if we're looking for someone who's supposed to be the director of our Human Rights Office, do we really want to vote forward something that is going to be essentially their work plan? Would it make more sense to present this as, here's something that we're envisioning, and maybe whenever we interview, have them come in and give a presentation on what their vision is? Because I think it would be really hard for someone, especially, maybe they're the director in Onondaga County. If they come to interview, I don't think it would be fair for them to, for us to be like, here's your playbook. I would want to see what they have to offer.
Yes, and I appreciate that. As part of the conversation that we have had is to actually pick out the job description as written now and try and institute that into our current need and see if that works for us. So one of the first things that we would do is to review the job description and enhance it so that it can actually do the work that we expect from the office. And that would be a joint engagement between county administration, the commission, and also legislatures to make sure that the position is responsive to the needs within the community.
Right. And I think there are certain things that the commission does really well, like the events that you all hosted. Like, you're the ambassadors in our community, and you're the reason why we had such great attendance for some of these productions. And so, maybe that isn't the job that we set aside for someone who, might have the legal experience or the policy experience. I think we really have to capitalize on the expertise of the commissioners and then on the expertise of whomever we hire.
Absolutely.
Absolutely. In a complimentary way, I think that's what we want. Because it is delaying, we were planning on unmute yourself on immigration. Yeah. We've had to kind of push it back. So we're like, come on, county, let's get this office running. Yeah. Yes. Mm-hmm.
So on this page, we talked about leadership, commitment, and accountability, and we discussed that the Office of Human Rights, the Human Rights Commission, and county administrators will sit together to evaluate the needs of the office, have a joint strategic planning and transparent metric development, provide necessary resources for restructuring, and also support a comprehensive staffing development. As we know right now, the only staff in the office is titled secretary to the office, but what we are trying to do to make more of an administrative role so that they can coordinate the administrative functions of the office very well. And we talk about championing the revitalized office across the county government, so enhancing our county operations in line with the needs of human rights within the community as well. So we talked about the process improvement, modernized complaint intake and tracking process. One other thing that we identified is that people comes in, file a complaint, and there's no process to follow up. There's no process in place to check in and see where that complaint is going. We talked about enhancing that process. And also regular status updates to complainants in their preferred language. We also talked about mobile intake processes as well, and regular audit to make sure how the cases are being handled properly, or there's a procedure in place for case handling as well. We also talked about integrating the community justice center functions. There's some element of the language that we put here that over the few weeks ago, our various conversations has also changed the language as we put here. But the fundamental notion of this particular slide is to integrate and enhance the work of the Office of Human Rights with the Community Justice Center. And this is not to say the Human Rights Office would take over the Justice Center responsibilities, no, but to improve on the integration of those two functions. So in terms of our proactive community engagement strategy is to, as Pei talked about, restorative justice practices for addressing discriminations and complaint, community-led conflict resolution and mediation. And I believe that Pei has pretty much went through all the slides in her earlier conversation as well. So I'll move on to, so we talked about addressing specific community needs, tailored approach for diverse population, and communities of color, cultural responsive outreach and services. She mentioned about immigration communities as well, multilingual resources, and also navigator support system. In terms of the LGBT community, which was about staff training on specific discrimination issues. So it's more about the staff awareness. So the staff in the office being aware of what some of these trigger points are and how to engage the community very well and address the community challenges and needs as well. So it cut across all the things that we anticipate an effective office will be able to produce. How do we measure success? We discuss implementing processes to be able to go back and measure impact that the office is having within the community, case resolution time and complaint satisfaction rate, and community awareness survey results segmented by demographics, and also number and impact of proactive intervention and restorative practices, as Pei talked about earlier, catching those cases earlier and intervening to make sure that we're able to have a resolution, and also following up to make sure that those resolutions are sustainable. And not to bore you, you all have the presentation. So resources and implementation plan, what we discussed is staff training in trauma-informed and restorative approach. So these, as I mentioned, these are the things that we discuss will inform who, if we're moving forward or when we move forward, who will, what will inform our process in identifying a new person to lead the office. So as I talked about, job description update, and also coming up with a real goal of what kind of individual we are anticipating to have in the role, and how their interaction will be, and also working with them from the grounds up to identify the shortfalls and also really come up with a plan that is effective and efficient. We also discussed strengthening the structural impact. That's the regular reporting to county legislature on human rights indicators. We also evidence-based policy recommendation rooted in community input and cross-department human rights training and assessment. So the office can also form as more of an interactive engagement with the county department, the community, especially when you look at whole health, social services, highway. There is a public engagement aspect. So how does these departments also respond to our challenging communities as well? And the Office of Human Rights can play that critical role through staff training, through department engagement, to help us be aware of those needs within the community and be able to be informed on how we engage in the community as well. So we also look at various counties and what they have done. Winchester County Human Rights Commission implemented a multilingual complaint portal that resulted in 35% increase in case reporting from immigrant communities. We looked at Erie County Office of Public Advocacy that developed a neighborhood-based right hubs and increased community engagement by 60%. Albany County Human Rights Department created a joint task force with community organization leading to successful resolution of 75% or more discrimination cases. And also Suffolk County Human Rights Commission established a mobile outreach program reaching rural communities and increasing awareness of services by 45%. Morrow County Human Rights Division implemented collaborative restorative justice practices, reducing formal complaint processes time by 50%. So we look at what other counties are doing, and I think there is a very successful outcomes if there's enhanced office and also better community engagement as to the roles of the office and the functions and the expectations of the community, which is the most critical part. We discussed technology and bringing in some supporting the office with some data, with some resources to be effective and efficient. And some of these functions can leverage on what we already have in the county. We have an office that are responsible for GIS. And how can this office help the Human Rights Office with data to support their work, to see which areas are they getting most complaints from, and what are the main issues that exist within those communities, within those areas. So it's more of the office integration. All of us in county administration, in IT, in assessment, supporting the office to be successful, not leaving the office in isolation to fend for itself. But we providing that that bridge internally so that the office can rely on the other department to be able to respond to the community needs and issues that they identify. So one of the things we talk about is enhanced partnership with the community. So community advocacy organizations through formal agreement, fifth communities, and all these things are expectation that having somebody in the role working with the community to come up with. It's not something that I can wink. I don't have the resources to be able to do that, but having somebody who understands those needs and researching them and working with the office to help promote and engage the community about. So some of these are more aspirational, but having somebody in that role will be able to help us to identify what exactly is happening more, and also coming up with solutions that we can support and help them to succeed. And so, as I mentioned, these are all aspirational visions and ambitions, but the success of it depends on having the staffing in place, working day in and day out, and trying to achieve the goals. What we can do in the office is to come up with a broader vision and working on day in and day out with the individuals in the office to be successful and have a positive impact within the community as well. So the next steps, formal approval of restructuring plan by all of you. As I can see from my time here within the last 5 months, there's no specific legislative action that has been taken, so you really don't need to do anything by just providing us the support for us to move forward and making sure we revitalize the office. We go out there and seek somebody who really have a community interest and willing to have a positive impact in the community, being in the role, working with all of us to make sure citizen residents in this county has a place to go, has a shoulder to cry on, and has people willing and available to listen to the issues that they're having, either in their homes, at their workplace, or through the encounter within the community as a whole as well. So what we talked about is revitalizing the office to make sure it responds to community need, leading innovative approach to restorative justice, proactively addressing emerging human rights challenges, and also foster a culture of inclusion and equity countywide. Demonstrates measurable impact on quality of life and become a model of human rights work in mid-sized communities across New York State. So we want to be able to be that example. And also, as I indicated what other counties are doing, some counties will also look at what we're doing and set that example for themselves to follow as well. So that's all I have here. I'm open for questions and answers. Pei is here, will be giving us all the answers, and I'm an observer at this point.
I missed Annie earlier. She had her hand up, and I missed it. Annie, did you still have a question or something, if you're still there?
Thanks, Travis, for letting me chime in, even though I'm not a member of this committee. I'm the liaison to the Human Rights Commission, as you know, and pretty much you folks on the committee said most of what I was going to say. But I think the only thing I would add would be that I'm really grateful that we are where we are in the respect of, you know, there are some concerns that people have brought up, you know, like regarding the folks on the commission doing really staff work. But I think the silver lining here is they were able to do a deep dive into what the community needs. So I am really grateful for them doing that. It's unsustainable. I'm glad they're going to be wrapping up, you know, the amount of hours that they've put into it. But they are experts in their fields, and especially with human rights. And so too, you know, we are really lucky that they were able to do this long enough that they could really look at the office and give us some really, I think, really helpful guidance, you know, along with Corsa to give us a real template for a possible path forward. So that's all I wanted to say. Thank you.
Absolutely. Anybody else before we wrap up? Ready?
Yeah, thank you for, thank you all. There's a lot of work in here. I'm sure this took a lot of time, a lot of effort by a lot of people. I like what you did here, and I'm going back to the kind of slide that Amanda looked at, the reimagining structure, and I think that's the key as to where that's going to go. I really appreciate, I think delineation is really important in very clearly identifying exactly what it is the Human Rights Office is going to do. I really appreciate understanding more about what the Human Rights Commission role is and the legal side of it. I'd never read those or heard those, so that really helped me. I think the investigation is something that, you know, I heard we couldn't do, but we can do some, which is great. But I think technology is really important as well, and how we track all these things till we see the benefit as we look at funding these things. So I really look forward to it. Thanks.
Amanda?
Yeah, I guess, yes, this is incredible. This is an incredible amount of work, and I really appreciate you all for taking the time to do this, and, you know, there's so much to work with here. I guess one question is, like, what are we looking, like, what's the next step? Like, obviously, like, yeah, we didn't do any resolution to take away the office, but what is it you're looking for from the legislature to move forward? So that's one question. And then to answer that for myself, this is a very aspirational document. And like Shauna said, you know, I think we would want to give this to a new director and say, here's what we think needs to happen, but what do you think needs to happen? And I guess I would also want something just a little bit more practical, like a document that says, here's the roles and responsibilities of the office. Here's the roles and responsibilities of the commissioners. Here's the legalities. Here's what the office can legally do, and here's what the commission can legally do, and have that defined very clearly and what those roles will actually be. Yes. Just so we all, the legislature now understands, the next legislature understands, administration understands, just so we're actually all on the same page. I would like to see that.
Yeah, thank you. And I think from the first point, the first question is you don't have to do anything. You just have to say, we have you have our support. Go out there, look at the job description, amend it, bring it to us, let's discuss it. It doesn't have to be a committee. It can be a meeting over Zoom, share ideas. Get a lot of input also from you as legislators, what you want to see as some of the descriptions or expectations of the role, and also writing that into the job description. And then if we are lucky and we get somebody, I don't know how long that will take, then coming together with this individual to say, this is our aspiration. What are you also seeing, and how long would you need? And working with that individual on a daily basis to make sure at least we can get closer to the aspiration, and also they will be effective within the community in terms of engagement, in terms of advocacy, in terms of training and outreach and all those pieces. So it's based on the person, and I think we will require a lot of input from all of you in trying to identify that kind of individual who will be willing and able to sit in the role and help re-engineer the community perception of the office as well.
Shauna?
I think what would be really important in the next few meetings that we have at the legislature is that we understand what the financial implications are going to be for this office. And I will say, with the political divide in our country, we're also feeling it in this legislature. I think at some point we probably need to have the vote to make sure that the commitment is there from this legislature. And I think it would be helpful to have Payee and the commissioners come in and talk about the good work that you're doing, talk about the people that are walking through the door, and really draw a picture for everyone so that we know what's happening in that office.
I agree.
So real quick, I appreciate everything Amanda said about the simplicity of this is what this group does, this is what this group does. I do agree with Shauna when it comes to the budget. The good thing is the money's already there, so people have to vote to take it away, which is a lot different than voting to add something, right? Especially in this particular climate. I appreciate the research paid on the investigation portion, but given all the stuff that we dealt with before, I do think it's important maybe for you, Maury, and you and Corsa to kind of come together and say, this is exactly what can happen, because I don't want to end up doing good work and being right back in the same situation we were in last time. So if there's a way to do some things, let's find out what exactly it is and how far we can go and do it. So I think that having a blueprint for a new hire is very important. I think that we've had a lot of conversations, it doesn't even matter what department it is, about what they're doing versus what we want them to do, and what that looks like. So you do have to have a blueprint, you do have to have a path forward, and you have to have somebody that can incorporate their vision into what we would like to see happen. Otherwise, we don't have what we want to see happen. We have what somebody else wants to see happen, and I don't think that's what we're looking for. So thank you for all your hard work, and I look forward to the next steps. We do have, did you?
Oh, can I say two things quickly?
Quickly.
To you, I'm not on the committee. One, this looks great. It looks like a scope of work that eventually would involve a much larger Office of Human Rights than we recently had, obviously, than we currently have with one person. And I think we need to acknowledge that at some point if that's what y'all are thinking. It seems like if we, the legislature, give clarity and resources and structure to more people, there will be plenty of work to do and they will be busy, per what Pei said. The other thing is, I know our current Office of Human Rights and Human Rights Commission's existence and duties is codified in the county charter, Chapter C, Article 26. So a thing to do would be to review that and also consider if we don't want it going forward to match word for word what it is, there will need to be a public hearing and local law and all that jazz, right?
For a charter
to change it? Yeah.
And I just want to add that I think there's a quality context in the charter for us to be effective. And what I'm seeing from my point of view is more of marrying those two pieces together administratively and making sure there's that coordination of responsibilities and functions. That the charter needs some degree of amendment. Yeah, that's why we have ability to amend it every 10 years or review it. But I think there's sufficient context in the charter provisions now for us to really support the office to be effective.
Yeah. Thank you. I think these are excellent, points. I'll be happy to work with COSA, Maury. I'll also reach out to New York State because I think that the charter, what really took me by surprise was that the charter really contains those provisions. They were just insufficiently or inadequately utilized. So I would say maybe out of about 7 core mission responsibilities, perhaps the office focused on 3 and did those very well. And maybe it's time to really take up, and that's what the community is asking for, is take up these other areas. And I think it'll be great to, as Amanda said, to have this clarifying document. I found that many commissioners, when they joined the commission, are also very confused about what is our role, and we're encountering very practical difficulties as the county also tries to resolve this. We've had criticisms, why using a Gmail if you are created? And so I would talk to the county accounting and county ITS, and they're like, are you like an NGO? I was like, no, we're not an NGO. The county can dissolve us. Oh, so you should have an email? Is it unprofessional not to have that? So, and that's just the nature of human rights. It's going to take a lot of work for us and discussion for us to find out how to handle this, this animal that is very powerful. But I'll be happy to kind of create a very short thing that's a handy, look. And I think it'll be great for the commissioners and for staff to also use that as a way of understanding.
Thank you.
Thank you, Peggy.
Thank you.
It is 2:07. We have more on Corsa's end on the county administrator's report with Sam and some reporting. And then we have several reports and discussions from others. So we want to move along. Sam.
Yep. Thank you. So,
Can you pull the microphone up?
thank you. Forget about that. Okay, so the opioid funding was given out to 8 different awardees about 2 years ago. We have a total of $722,374 that was awarded. We've already expended about half of that, which is $345,813. We do have 2 awards that are complete. And we have 2 more that are in the final stages of being complete. They should be done within the next month. So we only have 4 more that we anticipate going into 2026. And we have 5 different recipients here today to talk briefly about what they've been doing and what they've been able to get done in the last couple of years.
All right. You want to invite him up?
Sure. We have TST BOCES. We have Melissa Dundle and Jessica. Yep, come right up.
Anyway.
Together. Great, hi. Thank you. We are TST BOCES. I'm Melissa Dundal. I'm a pediatrician and I'm the medical director for the school health team. And I'm here with Jessica Hoff, who is the...
You pull the microphone up.
Sorry, hi. I'm here with Jessica Hoff, who's a physician assistant and the other half of my team. I brought some handouts for you all. I'll pass around. One is just a quarterly report. Then we have an agenda of what we were going to talk about today. We have the agenda of what we've learned during the PEP meeting. And then the last thing is a chart of our huddles. Jess will explain that later, but I'm going to begin unless you have questions. Okay, so we came here, I can't even remember when we came to start the presentation. I can't remember if it was last fall or in the spring, but since we've seen you, we have almost completed our PEP certification. So that's a psychiatric education for pediatric providers. It started on September 14th with our in-person day, and then we've since been meeting almost weekly, 4 hours a week. So during that time, we have 1 hour of case discussion, which includes all of our fellows, a psychologist, 2 pediatricians, and a pediatric psychiatrist. We have 2 hours of didactics and 1 hour of mentorship. They've paired each of us with a psychiatrist, pediatric psychiatrist, who they thought would make sense. Jess will talk a little bit about it later. We've had 2 of our 3 in-person days, and we've all rotated through an urgent care at University of Rochester. It's a new pediatric urgent care. We got to spend the afternoon there. And they've also created a digital platform which has all the videos from our didactics, resources for us, articles, everything that we've been learning, and we put stuff in it for us to share. Our fellows are 6 of the 7 are from Tompkins County. One was in Tompkins County, but she's since moved. So Audrey De Silva from Northeast Pediatrics, myself, Jessica Hoff, Tiffany Lanza, who works at Northeast Pediatrics, Susan Salashore, who used to run the PA school, is now in Kansas City, but she is she's one of the head people at one of the major PA associations, so she's super powerful PA, who I think is gonna take this and run with it. John Semeska, who is now working at Reach Medical, and Andrea Torado, who was at Northeast Ped. She's retired, but is hoping to do some more psychiatry. We've also created an advisory board, which consists of us, some of the pediatric psychiatrists, and one of the psychologists. We will add to this advisory board next year as we move the program forward. I'm now going to just pass it on to Jess to talk a little bit more about our program.
So part of what we did in this program is to pair this with a huddle system. So what that is it's an interprofessional group of people that may comprise of primary care providers in the pediatric offices, a school staff, which the school kind of determines who that might be special ed representatives, might be teachers, might be nurses, to kind of have a conversation around supporting some of these kids. And in that space, we've tiered this so that way sometimes that conversation is only us and the primary care provider. Sometimes it includes the school staff. Sometimes it's all of us together, and there's another level that includes the pediatric and adolescent psychiatrists and psychologists from upstate. We have dedicated time with them once a week where we can build these huddles and pull people in for the conversations. As far as the PEP fellowship goes, what we're starting to see is that in these pediatric offices where there have been providers that have participated in the program, they tend to be that go-to consultant inside of their offices for these mental health, higher need mental health kids, where they can collaborate in that space, sometimes bring in some of those patients for themselves or just work alongside a colleague around that. Also, what we found so far is that with participating in this fellowship, we've all built this very large network of specialists that we feel we know very well now, spending almost 40 weeks with them and working with them. And so they are really a lifeline for us as providers, that we can call them pretty comfortably and run things past them and be able to have that kind of next layer of support. And we're hoping that that network will just continue, because we've built those relationships and collaborations already. And in another part of kind of what we're doing is a little bit of initiative around some legislative level processes. We've collaborated with the Cornell Policy Center and a couple kind of movements here. One is called the Bridges to Care. This is an idea where medical directors and their clinical designees would be able to go on school campus to evaluate, diagnose, and treat kids as a bridge to care. Currently, we're asked to do these health assessments for kids that don't have a medical home or primary care provider, but are not able to actually write prescriptions if they're needed on campus and as a bridge to care. So we're working towards an opt-in option for school districts should they want to participate in that. Another legislative effort is through Narcan, and Narcan as the opioid reversal agent for overdose, and allowing kids to be trained in school, potentially alongside with their CPR training, and then able to carry it on campus if it's the school district's opt-in to that process.
Yeah, and so the other thing we've been looking at is evaluation for the Pet Fellowship. I would say if you talk to any of the providers, they would say it was invaluable. I mean, it's amazing how much we've learned and sort of the directions it's taken us. We did some pre-surveys about just knowledge of different mental health issues. We'll have the post-survey, but we also just got a grant to have Lisa Horn do a formal evaluation, looking at key points of inquiry so we can know what we're gonna sort of do next year. We all want it to continue, we just don't know in which capacity and how we're gonna change it to make it better for everyone. So that will be happening over the summer and into the fall. We'll then be spending next year working with the University of Rochester and Buffalo to work on expansion. Again, we all think it's amazing, and anyone who's heard about it that treats kids wants to do it, honestly, if they had time. But we don't know in what capacity we'll do that. We also know that our fellows now will continue some support, whether it's monthly meetings, running cases. We're going to try to figure that out too. Next step for BOCES is during this, we were connected. One of our presenters was someone from Boston Children's, and she presented on substance use. We had multiple presentations, but we connected with the Adolescent Substance Use and Addiction Program called ASAP at Boston Children's. We've been meeting with them weekly. They work a lot in the schools, and so next year our plan is to focus on substance use. In this time that we use for PEP, we're now going to move on to substance use. So we're looking at focusing on vaping and cannabis, on education, but also on policies and treatment for kids. So that's a quick overview. I've included if you want to look at our didactics schedule, it's super interesting. It did change a little bit mid-year when we thought we needed more stuff, so we were constantly asking the fellows what they needed, what they didn't need. But we've been really lucky, and we thank you so much because we really think it's invaluable, and we do think it's something that could be expanded to the state.
Thank you. Questions? Sean?
How are you funded for next year?
Next year, we're not funded. And the time, BOCES allows us the time to do this work, so we're going to be working with Upstate and Buffalo and Rochester and figure out the capacity, yeah.
So we're looking for another cohort not to start until like 2026 fall.
Yes.
And so we'll be doing, kind of in this time planning and outreach and trying to recruit other providers to participate.
Great, thank you.
Yeah.
What kind of feedback are you getting from schools? Is that something you're collecting, or from the teachers or the professionals?
Yeah, the huddles started before the PEP Fellowship, and it's really tiered out. Initially, when we planned this, we thought that we would have the PEP, since most of our referrals are honestly mental health issues, we thought we would be running PEP huddles, but we ran into complications with being on school campus, also with, we need we're not necessarily the providers who write prescriptions, also with consent and things like that. So we've tiered the huddles, and we do use our education to help put them in tiers, and those huddles are being tracked. Yeah, that thing. It's changed. It used to be just one huddle. We used to call the huddle with the PCPs and the Project Teach and the schools, that was our huddle, but now we realized not everyone needs to go directly to a psychiatrist. A lot of it can be managed with their PCPs, or they just need to connect. Those we're tracking, and so we just sent out a Google survey
for evaluation of the program.
huddles.
So we're just starting to get feedback on that this week, actually. We sent it at the beginning of the week.
Yeah, and we're learning, like, as we build systems, we're like, ooh, we should have got that data last month. And so we're adding data collection points as we go so we're learning. It's getting way better. It's so much better than it was last year, and I feel proud of the stuff we've collected, but yeah.
I'm looking at, this is Project Teach Fellowship, and that there's still unspent funds, so this is going to continue for the next year, you think?
So some of the funds, when you allocated the funds, some of it was for teaching, some of it was for supporting Tompkins County Fellows to do it. We're trying to figure that part out. I know for what we're hoping is that those funds could support Jess and I to keep going with the substance use and creating the program for future. But some of the other, like Northeast Pediatrics, I'm not sure how they're going to use their funds, because they did give the pediatricians some time from the practice, so we're trying to figure that out. So about 57,000, I think, are for supporting the fellows themselves. So yeah, but we are going till the 4th, and also some of our funding will sort of still be there to help for the monthly follow-ups. We'll be able to do it because it's not all spent from the original 50. Does that make sense?
It does.
Okay, thanks.
Well, thank you for sharing. We really appreciate your time.
Thank you for supporting us. It's really.
Thank you for having us.
Absolutely.
Thank you. I kind of fumbled on their names originally. It's Melissa Dundle and Jessica Hoff from TST BOCES, so I apologize. The next person we'll bring up is David Saunders, the Executive Director of OAR, and their program was Peer Crossing.
I didn't bring a handout, but I do have a PowerPoint that I'll share with Samantha, and if you'd like to see it, you just ask her and we can send that out. I just want to first commend the committee. When I applied for this grant, I did not think I had a really good chance. I thought maybe there was a 10%. I did what I thought was necessary to do with what I was seeing in the community. So I do want to say kudos to those. I thought that it was very, very slim. I did have a couple people from the committee come to my office to talk to me about it, and saying that housing is an extremely important part of helping people with sobriety. So as a reminder, we have a program. There's 4 parts. Can you hear me well? Yep. The first part is a peer crossing program, which was a standalone. The second was a combining Sunflower House with peer crossing, which would be 6 beds, partial utilities, and 12.5% of 1 staff person. You know I like stats, so I'm going to hit you with some stats to start. The interesting part is housing in our community is becoming more and more in a crisis level. So in 2022, Sunflower House had 30 different people. In 2023, it was down to 14 that we moved in and out. 2024, only 10 moved in and out. And right now, we've only had 6 new people. So we're having a really tough time moving folks from low-income housing to permanent housing. And because of that, the numbers are lower than I anticipated. So far, since we've had Sunflower, we've had 60 participants. But with the opiate settlement money, we have had 18. The length of stay has ranged from 12 to 735. It's supposed to be 365 max. Again, difficult times, and there's a lot of barriers. So before I go into the numbers, shelter is critical if you're dealing with someone's mental wellness. After shelter, it's safety. You have to have shelter, but you also have to have a safe environment. Without safety, all energy goes to defense. So you're not going to help people get better. So those are our 2 things. We want to have a place for people to stay. We want to make sure that they're safe. Once that happens and they're sober, trauma boils up to the top. And if you're not ready to deal with that trauma, you're going to lose them to either substance use or back to homelessness. So those are critical components of what we're doing. So we've had 18 participants on average, 242 days housed. 8 of the 18, or 44%, are people of color. All combined, all 18 people have stayed in our residence for just under 12 years. 88% had come from homelessness. 100% have been linked to supportive programs. This is the clicker, which is something that's been working really well as of late. 13 of the 18 received full-time or a part-time job. 9 were full-time, 4 were part-time. If you want to be employed, there are many opportunities, even for folks that might have a criminal justice background. 33% have been linked to mental health supports, 67% have been linked to substance use supports, and 27%, or 4 of the 18, have been linked to certified substance use treatment programs. In fact, we've had 4 people go in 8 times for over 300 days. This was something that in the past, if you were in Sunflower House and you needed to go to treatment, you would go to treatment, you would lose your spot, and then you'd come back and you'd be homeless. And so it was kind of a cycle that was wasting the treatment, because now you're homeless and you have all these triggers. So we actually use the opiate settlement money to hold that room. And so that's why we have a lot of people that are going to rehab, coming back right to the same room, their belongings are still there, and they can start fresh. Of the exits that we've had so far, of the 18, we've had 12 exits. 8 have found permanent housing. 2 have gone to jail, but they've been very short jail sentences. 1 homeless and 1 temporary housing. 6 are still currently Sunflower House residents. So when you come into the peer crossing program, you're interviewed, you're talking about a substance use problem, we make sure we have an available spot, and we develop a care plan. And the individual actually designs the care plan with us. What is it that you want to do with supports? Who are you working with in the community? Who do you want to do with mental health? Who do you want to work with for substance use disorders? And so they basically design the plan, which I think is really, really important. And then what are your long-term goals? And of course, we want to look about, this is a temporary housing program, so we want to talk about permanent housing. Typically, we talk about employment unless there's a disability or another issue. One surprising thing, and this is good and bad, OAR actually received cut in funding last year, so we actually eliminated 2 positions. So the person that was getting the 12.5% is actually our housing coordinator and our outreach worker. So as she was doing that work, she engaged with 11 people during outreach that she ended up helping get into substance use treatment as part of the work that she's doing with the peer crossing program. Of the 9 that were engaged, 6 completed substance use treatment, 3 actually have full-time jobs, and 8 have become permanently housed. So that was a side thing that we didn't expect to happen with the program, but because of lots of changes, that's where we're at. The peer crossing program, the standalone, was supposed to be 2 to 3 units, women coming back from treatment center. We have been turned down. We tried all out in the country. We wanted to get away from Ithaca. We were turned down 5 times. I gave up for about maybe 5 months. We do have a new place. We have a double bedroom at Art House right now, which is where we're going to start this particular program. We've been negotiating with them back and forth. I confirmed before, I said, I'm going to the legislature today, make sure that I'm not misquoted. We're going to have this room by the end of the month. They said yes. So we are working with that. We'll be there probably every other day. 2 women coming back to the community from a treatment center, and we're going to provide the wraparound services necessary for them to be successful. We're thinking about 3 to 6 months, but that's the idea of the program. The only other component I did want to share with you, with the opiate settlement funding, Sunflower still exists. It would not have if we did not receive that funding. I don't think I would have taken the financial risk if we weren't receiving this money. So we're about 1.5 years in on a 3-year program. So that's going really well. But I want to share with you is I like to collect IPD data on 911 calls to all locations in our community to kind of see what they look like. And if you look at low-income housing areas and you look at Sunflower House, in 2023 we had 80 calls. In 2024 we had 41 calls. So far this year we've had 4 calls. That's better than Cayuga Loft. That's better than Gateway Commons. and that's better than city center. I really believe that the wraparound services and buy-in from the individuals makes it a safer environment, which is quite evident now and has really been highly successful for this program. So I really appreciate your time, and if you have any questions, feel free.
All right, thank you, Dave.
My pleasure.
Thank you.
Thank you.
We'll bring up Currie Barnes, the Executive Director of TCPL, or Tompkins County Public Library.
She's not the director of the library.
Oh, okay. Thank you.
I don't have a handout or PowerPoint, but I have books.
Oh.
And I apologize, I'm presenting on behalf of the library's project manager who just went out on medical leave, so I'm reading his report here. Our Narcan vending machine has distributed over 200 boxes of Narcan since it was installed in November of 2024, so that's over 400 doses. We've had about approximately 40 library staff have been trained in the use of naloxone, while the library already had supplies at all service points, the reference desks, in the circulation back room, and as well in the wall-mounted AED locations. We've also added supplies to public programming rooms, such as our Borg Warner public meeting room and the Thaler Howell Youth Program room. We have a quote from a library clerk who said, "Within the first month of receiving Narcan training, I was in a situation where I had to assist a patron who had overdosed in one of our public bathrooms. As opposed to times I've had to perform CPR, I felt no panic. My training had been thorough and clear, plus Narcan is simple to use. I carry doses with me now everywhere I go, and I even feel confident sharing with others how to use it." The library has been offering training once a month to all community members, open to all and for free since the start of this year. We've had on average 5 attendees per training, and that's something that we would like to use our remaining marketing funds to try to increase, and I'll talk a little bit more about that later. Several programs were organized to help increase community awareness of both the opioid crisis and the resources the library has available. 2 of the most notable of these events were a resource fair in fall of 2024 and an author visit with Maya Salovitz in April of 2025. The resource fair aimed to get our community members in contact with a host of different resources available to help them support loved ones, access recovery, and prevent overdoses. Prior to the author visit, all library staff received a copy of her book, Undoing Drugs, as a community read, so they could better understand harm reduction themselves and to share the knowledge and information with library patrons. At the author visit, copies of Undoing Drugs were also given out to community members, but we were surprised by how many people showed up with their own personal copies, which is how we have some extras here. We were surprised how many people already had it. And for that program, we had 42 people who attended in person in spite of it being a holiday weekend. I believe it was Easter weekend. And there were also protests occurring simultaneously on the Commons, so we were impressed we got that many people to come in. There were also 61 who watched it on the live stream, and social media clips on Facebook and Instagram had 2,181 views and a reach of 1,769 accounts. Let me see where else he had that. Yes, the library's attempted to reduce stigma in a number of ways. First, all staff received training in trauma-informed librarianship and received 3 books each, 2 workbooks on trauma-informed library practices and Maya Salovitz's book, to help staff members engage in trauma-informed library work and in harm reduction. And this allows staff to model behaviors that reduce stigma, inform others about harm reduction, and generally interact with patrons more intentionally. There's also just the fact of the library being a stigma-free place. You could be walking in to get books for your child, you could be walking in to get Narcan. It's kind of general. The library also provided workshops for the public on trauma-informed librarianship and survivorship. We coordinated the author visit with Maya Salovitz, who herself benefited from harm reduction and spoke about her personal experiences with drug use and how harm reduction can truly help. We have been providing the monthly Narcan training with the REACH Medical Project, and we also have had meditation and mindfulness sessions with Anna Salomon of Firefly Farms. And again, because these are library programs, they are free and open to all. These monthly programs will continue until the end of 2025 and beyond the grant funding, because we had an anonymous generous donor who stepped up to make sure that that could continue. The library has been distributing fentanyl and xylazine testing strips since well before receiving this grant, so the numbers have not been purposefully or meaningfully tracked. They are regularly distributed to convenient but discreet locations throughout the library floor to help reduce fear of judgment while making these test strips accessible. We've developed several new partnerships. Most notably, we now have a strong relationship with the REACH Project, and they've been helping us to keep our vending machines stocked, and have also been providing the monthly trainings for patrons. We also have a relationship with local advocate and educator, Karina Hagelin, who has provided 4 workshops for us, 2 for staff and 2 for patrons. And about $1,400 worth of new materials have been added to our collection, both for adults and teens and youth. And a sample of titles are Open When, A Companion for Life's Twists and Turns, a kid's book about trauma, Raising Lazarus, Hope, Justice, and the Future of America's Overdose Crisis, What's the Big Deal About Addictions, Answers and Help for Teens, My Brother is Not a Monster, A Story of Addiction and Recovery, Addiction and Overdose, Confronting an American Crisis, and Harm Reduction, Public Health Strategies and Opposing Viewpoints.
Any questions? There's no questions. Oh, Randy?
Yeah, thank you for coming in and for that information. The budget going forward, you're primarily for marketing and information. Do you have funds for buying more Narcan and so continue to supply your machines? Or
REACH Medical has actually been providing us every month with, I think, 20 boxes. They've been restocking our Narcan machine on a regular basis. It also gives them an opportunity to be at the library and be interacting with people as well. So it's kind of a multitasker. The funding that we haven't spent yet, we wanted to use specifically to target more populations about the training, as well as the resources that are available. We're going to be having a lot of new students coming into town in a few months. We wanted the opportunity to make sure that they knew what the library had to offer them as they come to spend some time here with us. And we also wanted to get our trainings in front of targeted groups such as local bar staff, church groups, Boy Scouts, Girl Scouts, parent groups as well too, people who may not have gotten this in another way, or just need to know that these resources are here downtown at the public library for free.
thank you.
Thanks.
Thank you for coming in and sharing.
Thanks. Any others here? Anyone who?
All right. Thank you.
Thank you for bookmarks.
Thank you, Currie. We'll bring Samantha Stevenson
I'm surprised you'd go grab those books.
up. She is on virtual. She is from REACH Medical.
Hi, thank you. I'm Samantha. REACH Medical was awarded these opioid dollars. I think it was, I think our grant funding ends for this in 2026. So we do still have some funding left. REACH has a pretty robust outreach team, and it's evolved a whole lot over the past 5 years. So we have used these opioid dollars in support of the expansion of these services, particularly the expansion and implementation of adding wraparound services in the outreach setting. So we're an organization that has a lot of integrated care and service lines that we offer. And so we continue to kind of add as many of those in place as we can for our outreach services, because the goal is to reach as many people as we can and deliver as much care as possible kind of in those moments. So we kind of called this the outreach, or the, what did we call this grant? The REACH Community Wraparound Services and Overdose Prevention. So, and I'll talk a little bit more about the Narcan training initiative that we've also used these dollars to support. In 2024, we documented our outreach team working with approximately 350 unique individuals in the community. These 350 people, around 85% of them reported experiencing homelessness or housing instability while they were engaged in services in 2024. And we offered a wide spectrum of services from medical care to acute care, intensive case management, support for social services, like accessing social services, filling out paperwork, getting through that process, working to get people wrapped into addiction medicine services, or if they were due for addiction medicine services, kind of getting them that follow-up appointment. The coordination of health and wellness appointments, food pantry deliveries. We worked closely with people that were becoming housed, kind of getting through the system, and needing help with landlord liaison services. Our outreach team did a lot of that, especially as some of the new supportive housing units were opened. It required and continues to require a lot of kind of like post-housing services there. Through that approximate 350 individuals in 2024, we provided close to 2,158 unique appointments. We also expanded by way of seeing an uptick in referrals. So more businesses began calling us directly for support. IPD increased their engagement by way of they're dropping people off on our doors, at our doors now, that instead of at the hospital or instead of in the jails, they're kind of bringing them for case management supports. And we've seen a notable uptick in that, especially in the past 6 months, which has been great. And additionally, as part of our opioid overdose response, we facilitated 38 Narcan trainings across the county. And through those Narcan trainings, we've distributed 939 doses of Narcan. And in 2024, we also distributed nearly 2,500 doses of Narcan to people who are in active substance use. So we continue to offer those trainings for free to anybody that asks. As the library said, we're always happy we're a New York State licensed OOP program, so we're always happy to deliver Narcan to the library locally. We also deliver it to Trumansburg Library, and we average about 5 trainings per month, business owners and restaurants and other local community organizations. So we continue on with this work in 2025. Our outreach team is out 5 days a week, providing a large spectrum of integrated care for behavioral health, acute medicine, physical health care, case management, crisis de-escalation, and we're just chugging along. So I'm happy to answer any questions that you may have.
Is there any questions for Samantha? No? Samantha, thank you for coming and sharing today.
Thank you.
Thank you. We have one more presenter, Robin Elliott, the Chief Operations Officer of Finger Lakes Reuse.
Hello, Robin.
Hi, everyone. Thanks for the opportunity. You guys have a big agenda today, so try to keep it a little brief. And similar to others here, I'm presenting on behalf of the coordinators for the program that would normally be speaking to you, and I believe who spoke to you last time. So I'll refer to my notes here. The funding that we're receiving through this source is supporting our Reset Job Training Program. So we've been doing training job skills in our facilities since 2013, and what this has been allowing us to do, we're so grateful for, is to work specifically with people in substance use recovery. We have been working with that population already. However, this is allowing us to do that explicitly and to give them more supportive services and to work more closely with partners and give our staff better training to work with them, to have better outcomes in terms of retention through the end of the program, placement into permanent jobs, and better tracking and understanding of those demographics throughout. So we've traditionally in our Reset program worked with folks with any kind of barriers. We work with adults, we work with people with mental health disorders, with visible and invisible disabilities. We work with people formerly in incarceration, and of course, substance use disorder does come up with our populations as well. And in this program, what has been going on so far is that we've completed our staff training goals. We've also gone through Narcan training with our managers at both locations. We are looking forward to doing implicit bias training this year as well. And we're working on, we've started out this first year of this project a little slower than anticipated in terms of getting folks into the door and building those connections with some of our partners to bring people on board. However, now we're really rolling. So I know you have our quarterly report in this packet. I've got updated numbers with me here that are even a little fresher than that. So we've recruited 11 trainees to date who identify as in recovery. 3 of those trainees have completed the program. 2 have been placed in permanent jobs. We also are bringing on another 4 in the next coming month in onboarding into the program, since it's on a rolling basis. And just to give you a sense of the demand for this job training program, which is paid from day one, we have over 30 people on the wait list for that program right now, and that's been pretty consistent throughout the year. So most of the funding that you guys have provided for this, that the county's provided, is going straight to wages for folks doing this training. And that is what's allowing us to provide as many opportunities as we can to people. And there's mutual benefit here, where not only are we providing job skills training, getting folks from wherever they're starting to a fully employable place at the end, but it's also supporting our reuse center efforts, right? Because people that are working with us are right in our operations, supporting waste reduction efforts, working in customer service skills, et cetera. Yeah, thanks so much for the opportunity to update you.
Questions? Thank you for taking your time to come in and share.
Thank you.
Thank you. Looks like we have a resolution.
Yes, TCPL would like to request their budget for opioid funding that was originally awarded. They'd like to request changes. So they're more apt to be able to actually spend all of the funding.
All right, let me read it out and get a mover. Request to amend Tompkins County Opioid Settlement Fund Contract, Tompkins County Public Library, ID 13375. Do I have a mover? Amanda? Randy seconds. All right.
Thank you.
Is there any questions about this particular resolution? All right. All those in favor? It's unanimous. Is there anything else, Samantha?
No, that's it.
All right.
Thank you.
We are going to move on to the Department of Social Services. Who is here today is it Kit? Hello, Kit.
Hey, Chris.
We'll get your resolution done, and then we can do the foster care services. How's that?
Absolutely. Sounds great.
All right. We have a resolution contingent fund appropriation, Department of Social Services, 2025, budget adjustment for temporary housing assistance, shelter services, ID 13355. Do I have a mover? Shauna moves. Randy seconds. You want to share a little bit, Kit?
Sure, and Thomas Toll is here with us as well, and can jump in if we have questions. But basically, this is, so as people know, we are utilizing a hotel for shelter, and have a fairly new setup for that. This outlines a program expense of $450,780 that covers a period of time when we had to contract for the use of the hotel to be able to get the shelter set up. But due to the labor shortage, we weren't able to hire people, so we didn't have people sheltered there. We were actually hoping that some of that cost would be reimbursable through the state, because we thought we could submit it as an administrative expense. Unfortunately, we have received word that that is not possible. So, so we've got that factored in here. The professional services, which is largely our security detail on site for the year. And then some reimbursement that we will be able to pull in around these expenses, and a contingent fund request to cover these expenses. We need the spending authority to be able to move forward and pay the bills associated with these expenses, essentially. Anything I'm missing, Thomas, in all of this?
No, there's nothing you're missing. The expenses going forward will be negated by the client payments of shelter. So that's the one big thing. And then, of course, going forward, if we get the operating certificate of the hotel as a homeless shelter, then we would actually be able to roll some more of the funds towards the payments to Allied Security.
Right. Right, so these will not be, thank you, Thomas, I should have said that. These will not be ongoing expenses. There will be some local cost, as there always is, factored into sheltering people, but the majority of these expenses are the circumstances around setting up the shelter and getting up and running. We have currently submitted an operating certificate application to OTDA. It typically takes them a number of months to certify a provider, which we are at this point, to become a certified shelter. Once that happens, then expenses of the shelter are rolled into a calculation that OTDA dictates that will give us a daily rate, which will then be, we will seek reimbursement based on number of people sheltered at that location, based on that daily rate figure. So that's the process we're shooting for, and that once we get that operating certificate up and going, and we are a certified shelter, as Thomas said, that will change our circumstance and allow greater reimbursement.
We have to do something real quick here. Shauna has left, so we need a new mover for this resolution. Amanda's the mover. Randy seconds. Okay, we're good now? Okay. You have another question, Randy?
I did. Is this your last Health and Human Services meeting, or do you have one more?
I may be at next month's meeting. I know that I believe Donna is also in the room with you, so I'm not sure if she or I will be attending, or both, next month, but it may be my last, not positive.
Okay, well, thank you for serving, appreciate it. But I do have a question for you. Is the total expense after reimbursement to the county $450,780? Is that what I'm reading?
No, so Thomas, can you jump in on that? I want to make sure I say what's correct here.
So that's the cost of the first 2 months of January and February, where we were not using the hotel, so we are not able to get reimbursement for those 2 months. And then also rolled into that is some program costs, as far as like Kit was saying, getting things up and running, buying items for program use. And then also when we have people there, they may not have a case open. And so there may be a few cases where we can't pay the hotel room. So we may have that happen every now and then, but it's generally less than 5%, but I figured it at 5% for March.
All right, so I'm just trying to figure, so this is an over budget request, right?
Yes, we need the spending authority of that final figure, the 868,427, right, Thomas? That's what we're asking for. in terms of that spending authority, yes. And some of this, Randy, I will say, like I said, we were anticipating that some of this we were going to be able to seek reimbursement on through OTDA. Thomas just within the last week has communicated because Thomas had done a bunch of work to begin to file for that reimbursement. Reached out to OTDA to kind of clarify a couple of things, and OTDA informed us that we could not seek reimbursement as an administrative expense for that. So that was new information. Obviously we've never set up our own shelter before, so this is all new territory for us.
Okay, so the total amount that we're taking, contingency fund of $868,427, that's really what we're approving here.
That's correct.
Hi. Corsa requested that we do not act on this today and just make it a discussion. There is an issue with the contingent fund amount that they're requesting.
Okay. Okay.
Take the motions off the table.
So, yeah, so I could withdraw my motion.
Thank you.
Thanks, Amanda.
I'm good with that.
And would we then, when would we discuss it, at the next meeting again? Or?
I believe so, yeah. We'll find out here shortly.
Okay.
Okay. All right, so that is the end of that conversation. I guess we'll move on to the foster care services report and discussion. What, Norma Jane, you have your hand up, Norma?
Yeah, I just wanted to add that we will have to go to the Budget and Capital Committee to request an increase in the contingent fund, and then this can go to the Budget and Capital Committee for review as well.
All right,
okay?
Thank you. Yeah.
Okay.
Hello, everyone.
Hello.
My name's Shanice Riley. I've been with the Department of Social Services for about 16 years. Worked through many different capacities in child welfare. Currently, I supervise our Family Treatment Court program, which is a program that focuses on families impacted by substance use disorders.
Hi, I'm Leanne Musso. I have been with the department for about 10 years. I'm currently the supervisor for Youth and Family Services. While we do have kids that are in placement, our goal in this unit is to keep kids within the community and to prevent placement outside the home.
So one of the big things that I want to start by talking about is the efforts that we have been pouring into our community engagement. Very recently, with the support of our administration and Commissioner Kephart, we were able to set up a table at the Better Together event for our first time, trying to keep track of how many community members I spoke to, doing the best that I could while I was engaging. We spoke with over 200 members of our community at that event, that single event. We talked about positive interactions that folks had had with child welfare, and we talked about not so positive interactions. And I think that we were able to have some really good discussions about how we're doing things differently. And that's one of the main things that I want to bring to talk about today. We also, for April is Child Abuse Prevention Month. We were able to host an event at our building, at the Human Services Building. We personally went out and hand-delivered invitations to this event to all of our community partners, everybody that we could think of, medical centers, schools, whole health, TP3, all of our community partners. We had over 70 professionals come into our building to network. It was an incredible event, well-attended. It went off without a hitch. We have also recently, within the past few months, reached out to all the local school districts. And we're doing road shows. We're going out explaining what we're doing. We're getting our staff out in the schools so that educators and other professionals know who they're talking to on the other end of the phone, to really work on building that rapport of working with child welfare in the hopes that we have a welcome seat at the table to support families instead of kind of being on the outside. So the first couple of slides that we have here, we're going to really fly through. This is the presentation that we are presenting to the community as we're going out and talking to the schools. So that's just kind of the goals of what we're working on. So there's a new mandated reporter training that kind of initiated some of our response here. And the main concept is support it, don't report it. Building ways that we can have other professionals contact the department to address issues that might not have to rise to a level of a hotline report. It saves work for us, it's better for the family, we're able to engage easier, and it maintains that relationship with that service provider or that educator in the family to not have to burn that bridge. So that's the little bit of mandated reporter that we're, support it, don't report it. And then that's just our contact information to be able to contact the office directly instead of going through the hotline process. Of course, we can't give any information to folks as they're calling us, but we can say things like, I'll pass that along to somebody to get in contact with you if they have any questions, or something like, this sounds like it might need to be reported. Here's the hotline if you want to go ahead and call that number. So it's important to us that people know when a hotline report is received. It doesn't come directly to us, it's made to Albany. It takes us a little while to get the report, so we do ask other professionals to make sure that a number is left so that we can reach out to them. If it's an emergency, we want to be able to respond to that family in that capacity. If it's something that can wait to the next day, we want to provide respect to that family to call and schedule an appointment, you know, not just show up when it's not necessary to do that. A kind of new thing that I'm really excited about is when we receive hotline reports, we have two different tracks in Tompkins County. We have family assessment response and the traditional investigation that folks think of when they think of a child protective report. An investigation has that determination, that indication or unsubstantiated response, where family assessment response is focusing on building strengths of the family and working with the family to eliminate any barriers to parenting. We have done our best to combine those two. We're utilizing our strengths-based, solution-focused skills with all of the cases that we have, and all of our workers are keeping FAR and investigations. So if a case has to transfer, we're keeping the same worker to see the whole case through, which has been a really successful change. When a CPS report's initiated, we have 24 hours to make contact with the family and assess immediate safety, 7 days to kind of make that a more thorough safety assessment, and up to 60 days to complete an investigation. So there are a couple different ongoing kind of cases. A voluntary preventive services case, we receive a hotline report, identify some needs of the family, and they're willing to work with us, so we open up a case voluntarily. Sometimes people call and they've had cases in the past and they say, I need some help, can you assign me a caseworker? They open voluntarily. Mandated preventive services is when we have identified worries, filed a petition in court, and they're mandated by the court to work with us while their children remain in their care. And then mandated foster care cases when the concern rises to a level of immediate or impending danger and we've had to make an alternative plan for the children. So that's generally where our community engagement slides would end. That's just kind of, we call it CPS 101, like the basics of what we're doing here. So one of the things that I'm really proud of being a supervisor at DSS is we are afforded opportunities to learn the best skills that are out there to engage the families that we work with. It's supported all the way up, and we've had some really amazing opportunities. The first one I'll talk about is signs of safety. This was something that was began to be implemented by OCFS probably 3 or 4 years ago. Tompkins County was picked on 2 different occasions to do a whole systems learning case where we were able to work with certified trainers in signs of safety through a process where we picked a case and did the casework over Zoom with the trainers working closely with us, and other states listened to the casework that we were doing. We got so many good things from this. OCFS has since kind of put a little bit of a halt on implementing it statewide, but we still have those skills and those tools, and we continue to use them. It really focuses on working with families to identify the risks, being transparent with families to develop that mutual understanding of what our worries are so that we can be solution focused and come up with next steps to work together to keep the family together. My favorite part of Signs of Safety is that concept of we're working with a family as a whole. We're not working with parents or we're not working with a child. We're working with grandma, we're working with aunts, we're working with next door neighbors, and that identified support network for families. It's been incredible to see. We've been able to keep kids at home. We've been able to identify different resources to step in and support the family. We've also been able to change some of our language, more consistent language across the department, and we no longer use some of the generic forms that OCFS has us print out, like a service plan. Instead, we use what we call a map that includes the family's strengths, what we're worried about, and concrete next steps on how we're gonna get there. That was something that we were able to get from the Signs of Safety program. Nearly all of our staff is trained in motivational interviewing, client-centered, goal-oriented, working collaboratively to best meet the needs of the family. Also solution-focused, trauma-informed care. We recognize that our system causes systematic trauma. How do we support people that have been through our system? How do we show that our system is different? And we're really working to help work with families, identifying strengths, promoting hope, avoiding re-traumatization. Some other cool things I think we have at the department, we have an advocate from the Advocacy Center who's co-located at DSS to help us with those cases that are significant interpartner violence, somebody who is more, who specializes in that. So that's been really beneficial. We also sit on a multidisciplinary team where our investigators are discussing and working collaboratively with law enforcement agencies, the Child Advocacy Center, medical providers, in cases specifically regarding child sexual abuse and physical abuse. As I said, I supervise Family Treatment Court, and I think that it's the best program ever, so I would be remiss if I didn't get to talk about Family Treatment Court a little bit. We currently have about 40 families that we're supporting. We have been a peer learning court for a period of time. It feels like we're doing things right. Like I said, if you want to go to the next slide, it's a multidisciplinary team. We have Honorable Joseph Cassidy as our leading judge, Mindy Thomas. We have a mental health liaison, substance use disorder liaisons on the team. We get to work with peers. We have 2 peers currently that sit on our team and are able to meet with folks. 6 caseworkers, 2 senior caseworkers, 2 supervisors. We work collaboratively with the DSS attorney, respondents attorneys. The AFC sits on our team. We're able to meet every other week to discuss these cases, to discuss barriers that our participants are having and how we can meet their needs more effectively.
I'll focus a little bit more on our preventive services and what we're doing to keep kids at home and in their communities and out of placement. So the goal of the services in our unit are to address children's problematic behaviors within the community and to prevent placement outside of their home, whether that be in foster care, group homes, or residential settings. Currently, our unit contracts with 4 agencies within the community. The William George Agency provides the Therapeutic After School Program, or TAP, which we consider like a one-stop shop for our kids that are in need of mental health, med management, family counseling, substance use, and also some group and pro-social activities. That would probably be one of our most intensive services. We have the Youth Advocate Program, which really focuses on our high school age teenagers and developing independent living skills and employment skills. I think one of the most important things that program offers is a supportive employment program. So their program connects kids who are able to work with local businesses who are aware of the struggles that these kids may have, but also tries to teach them employment skills and skills that they can use later on in life. Family and Children Services provides STAP. While that can work with kids 8 to 17, that focuses more on our younger population who may be exhibiting some problematic behaviors, but kind of focuses on social skills and appropriate behavior in the community through small group activities. And our last contract agency would be through Liberty Resources and the Multi-Systemic Therapy Program, or MST, and that works with the family as a whole, really trying to change those behaviors within the home through some parenting strategies. Right now, we have about 36 families participating in preventive services. That number is probably a little bit higher than when we did this PowerPoint. And some of those families have more than one youth in a service. So those referrals are usually received from, sometimes CPS and FAR will send a referral if they see a kid that might need one of these services. Probation sends a good majority of our referrals, and sometimes community providers and families also self-refer to these services. Our unit also tries to work really closely with the community, and I think we've built some really positive relationships, not only with families, but with our service providers. We work closely with SPOA and the probation department, Learning Web, Youth Services. We have 2 senior caseworkers in our unit, 3 total within Youth and Family Services, and they sit on the SPOA committee, and they also sit on the CSEC, the Commercial Sexual Exploitation of Children committee, run by Youth Services as well. We're also present at every single youth part or JD PIN's appearance in Tompkins County Court. This is to make sure that we're able to assist families and maybe provide services right away to prevent further court involvement or to prevent them being placed in detention or a residential treatment center. And one of the most important things I really like is our youth review team. It is made up of DSS, legal attorneys, legal administrator, caseworkers, supervisors, probation. We have someone from mental health. We have someone from TAP, someone from YAP. A lot of different community providers come together to discuss, with family's permission, kids that are at risk of placement outside of the home due to their own behavior. And it just gives us a chance to discuss what we can as a community, what we can do as a community to provide interventions to prevent that court intervention, to prevent that placement outside of the home. And it's really nice to get other people's perspectives and to see what other community service providers can provide. Another helpful thing we have been able to provide to our families is respite. Respite can be used as a crisis intervention when, there's some tension in the home and they feel like, it might be helpful for the youth to be out of the home for, 3 days or up to a week just to get a break and to kind of let things settle down in the home before they return. This can help prevent some further escalation or maybe some unwanted behaviors by either the parents or the children. We've also been able to use this as in lieu of detention. So if kids are remanded to detention and they're deemed appropriate for respite, they can go to respite instead of being remanded to a detention, or if there's no detention bed available, having to sit at the sheriff's department. So that's been really helpful, and we used that a few weeks ago for a youth who was remanded, where he was able to utilize respite instead. This number is actually higher right now, but as of a week or 2 ago, we had to use respite 91 days in 2025. Just a little bit of information about our placement numbers within our 2 youth and family services units. We have about 41 kids placed outside of their homes. 33 of them are in foster homes or with relatives. Only 7 of them are in a QRTP, which is a residential or group home, so something similar to William George or a group home. And then we have 1 who is over 18 who's chosen to stay in care and is in a supervised independent living program, which allows them support, financial support, to kind of get ready for that transition into adulthood when they turn 21. And just a side note, obviously placement isn't anyone's first choice, and we all know the negative impacts that placement does have on children. So whenever a kid is placed in a residential level of care, we are required by OCFS to do a qualified individual evaluation. We contract with 2 providers, and that is to make sure that kids are in the appropriate setting and that their needs can't be met within the community. So we want to make sure that they're not in, we want to make sure they're in the least restrictive setting. So we utilize that every time a child is placed in care above the level of a foster home. Here's a little bit of information on our adoption home finding unit. The goal is always some sort of permanency for the child, whether that's returning to their parent, independent living, or adoption. Currently, there's 76 foster homes in Tompkins County and 93 children in foster care. And so far in 2025, 12 children were adopted into their forever homes. For our foster parent recruitment, our home finding unit will be holding 3 foster parent training class sessions this year. They run about 11 weeks, and they are meeting the requirements of the National Training and Development Curriculum. In our county, many of our foster homes are kin or fictive kin, so someone that the child has a relationship with. We strive to find foster homes with relatives or those having a significant connection with the child. Some are teachers, coaches, friends, neighbors, some positive adult in the child's life. And we have a staff person that is called a kin champion, and they work together to identify and certify these kin resources. We'd like to recognize our foster parents as well. Being a foster parent is not easy. So every year there's an event that's held to honor the commitment of our foster parents, because we know that parenting children is hard, and parenting children with trauma is even harder. So this is a nice event. It allows kids and foster parents and DSS staff to just kind of gather and have a good time, enjoy themselves, meet, and just kind of, yeah, it's just a good time for everyone. And this event is actually funded by a lot of local businesses, which we all appreciate. I think that's it. So I'm not sure if anyone has any questions, but we both brought our cards in case you guys do think of questions later on.
Any questions? Randy?
Well, that was a lot. And thank you for working at DSS. Both my mother and sister worked at DSS many years ago in child protective and welfare. So I really appreciate what you're doing. I'd like to learn more about this. And so whenever you do go to a school in Newfield or Renfield or someplace else, I'd love to just sit in and listen. So I've sat with some, the Newfield School District 4 times in the past 2 years and listened to them and their thoughts. And so I'd really like to be part of that, or at least to listen. So, but I have a question about your technology. So does all the software that is used by social services, is that state managed software? Do we have our own, or how does that work?
It's state managed software.
Okay. And so, of course, the schools have their own, which is also state mandated how they report things. Do you see that information at all, or is you allowed to see like their interactions with kids or families, or because they all have every child that is struggling, they track that in some way. They each have plans for them, and sometimes they hear what their issues are, right, with their families and whatnot. But that's probably, you never even see that stuff, right?
That's right, yeah. And there's a level of confidentiality there that would be a barrier for us to see that. But I do think that goes back to weighing the report it, don't support it, or support it, don't report it. You know, we have relationships with schools, and we're trying to build on those even more. But the schools and their staff have such close relationships with these kids and families. Many times that person who has the worry knows that they're open with DSS, knows that they have a caseworker. So being able to reach out to us, having that face or name to be able to call and say, you know, I'm worried about so-and-so, and being able to share some of that information on a little bit more of an informal basis while not breaking any confidentiality is that's really the direction we're working for.
That they know they have someone they can call, that they know, that they trust, and that they're going to get a call back.
Yes, absolutely.
Right.
And we've seen benefits from it. We are getting those phone calls. We are getting some engagement from social workers at schools and being able to have some of those conversations.
Okay, thank you.
Thank you.
Well, I was really excited about your presentation. I could see the enthusiasm. I started off at 2 months old, being removed from my home, and eventually adopted out. And I've had a life of working with young people and working with DSS. I spent 6 years working at George Jr. I'm a mandated reporter. I don't know how many times I've had to make that phone call, knowing that it was going to cause harm in folks' lives, but I didn't have much of a choice. So I really appreciate this idea of support, don't report. That's something I would love to have you all come talk to my staff at GIAC about, especially during summer camp. We have so many young people, but just listening to some of the things, the solution-focused, trauma-informed care. I went through the kinship program to become a foster parent, eventually adopt a kid, and I can speak firsthand to the efforts that were made at that time to get that young man into a permanent, forever home. So, hats off to the work that you all do. I know it's extremely difficult and challenging, but I really appreciate just where you all are with it. It's very heartening, and I just want to say thank you for your presentation.
Thank you.
We would like to leave our business cards. If you have any other questions or anything we can do, reach out.
Thank you so much.
Thank you so much for your time. We really enjoyed being here.
Well, the caregiver resource is going to move to July. Lisa's here. Lisa, do you have any department updates you want to give?
Thank you for doing that. Amy, our caregiver coordinator, has a meeting back at the office, so we'll get her back there. I just brought our annual report that we handed out at our annual luncheon in May, so I thought I'd share that with you guys if you want that. It's also on our website. And our 50th anniversary celebration is coming up. We're bringing back our Senior Living Expo, which we have not done since pre-COVID. It was actually scheduled March 2020, and we had to cancel that. So that's July 25th at the Hotel Ithaca from 2 to 5. We'll have about 30 different aging service providers tabling with us and some presentations, and that too is on our website that you can find out more information. So that's all I have to share.
Thank you. We will go to JR. Do you have anything you'd like to update, JR? Share?
All right, there we go. Good afternoon, everyone. Can you hear me?
Yes.
Okay, good. All right. Just a couple of quick things. One is that this month we hosted the bi-monthly meeting of the VA's Patient Advisory Council. It's a group of patients, veterans at the VA who meet here to provide feedback to the staff at the VA clinic, as well as get help with ideas for outreach and other things. This end of this month, the last Friday of this month, the 27th, our usual meeting for our women's group will actually be a special meeting a special meetup to honor our women veterans in honor of Women Veterans Recognition Day, which happened earlier this month on the 12th. And then my last thing is the big news for our department. On the day after Memorial Day, we welcomed our first VSO. Veteran Service Officer is Mr. Ignacio Lopez. And he has jumped in head first, and he's doing well, and you will meet him in August, if not before.
Thank you. Any questions for JR? All right, thank you, JR. How about Cindy? Are you still here with us, Cindy?
I'm here. Hi, how are you?
I'm good. How are you?
I'm okay. Janky internet again, so I'll make it quick. The HSC City County Review Committee funding process is wrapping up. It was fast and furious. After 22 hours of committee work, we had 30 applicants for county support. That included 5 new applicants this year. We've been at the HHS recommendation, opening it up for additional applicants. And the committee deliberated, and our next steps are to make our recommendations to the HSC board. And then they make those recommendations to Corsa Comfy for the budget process, which makes them to you. So more to come on that.
Thank you. Kate, good afternoon. Do you have anything that you'd like to update or share with us?
Yeah, good afternoon, sir. Just to highlight that we did have an information session yesterday for the Transformative Youth Justice Hubs. We had about 15 people on Zoom for that. We had city representation. Sheriff Osborne was there. Chief Kelly was there. Mona Lita was there. Charlene joined us for a little bit, and we had Village and some other folks. Southside was also there. And so we are looking at applying for this grant, which is due, it's $1 million that will be, 4 of them will be awarded throughout the state. We're looking to apply. It's due at the end of July. We're going to be forming a steering committee to share the work. We're still looking for a lead agency. We're hoping maybe TST BOCES. It has to be a nonprofit. Everyone was willing to help, but everyone is sort of maxed at capacity to do the lead agency part. So we're still looking at that, but hopefully we'll get a meeting in the next week or so, talk about the scope of work, get the application ready, and turn it in and hopefully see the fruits of our labor. So.
Awesome. That is exciting. I'm sorry I missed the meeting. I will be in contact with you to get caught up a little bit.
Okay, not a problem. We recorded it, so, and I think I sent you an email with the recording and stuff in it, so.
Cool. Anything else? Any questions?
Great.
Huh?
Yeah, I attended. It was a good group of people.
Nice. Amanda? All right. Thank you, Kate.
You got it.
Amanda or Randy, do you have anything you would like to share?
Just thank you to all the good presenters today and a lot of really good and important information.
Absolutely.
That was good.
Well, we are adjourned.
All right. And thank you to you, Travis.
Oh, you're welcome.